Hello, everyone. My name is Alexa Katz, and today I will be sharing my personal philosophy of health education and promotion. This presentation reflects both my academic journey and my hands on experience working in healthcare, particularly in dermatology. Now, for some background about myself. I currently work as a medical assistant in dermatology, and this has been a huge influence on the way that I view health education. Every day, I interact with patients who have questions, misconceptions, or fears about their skin health. Often, the most meaningful part of the visit is not any procedure we do, but the conversations we have and the education that we're able to teach. That is what has inspired me to pursue my graduate degree in health education and behavior. And as I look forward to my future as a physician assistant, I know that health education will remain at the heart of everything that I do. Even more, my experience in dermatology has shown me how health education can empower patients to prevent serious conditions such as skin cancer. I have seen patients go from confused to confident after receiving simple, clear explanations about how to take care of their skin. That is the kind of impact that drives me. Ultimately, I want to combine clinical expertise with behavior-based education to improve outcomes for every patient that I serve. My core philosophy is that health education is a vital tool for prevention, empowerment, and health equity. As a future PA, I believe it is my responsibility not just to treat illness, but to educate and to give patients the knowledge and confidence to take control of their health. I believe in the importance of health education. It gives each person, regardless of their background, income, or language, the chance to understand their health and make informed decisions. Without education, even the best medical care can fail. With it, patients become an active participant in their own well-being. This philosophy is grounded in three key principles. 1. Prioritizing behavior change through patient-centered communication. 2. Delivering culturally competent education. And 3. Promoting interdisciplinary collaboration within the healthcare system. Behavior change is the foundation of all effective health education. Simply giving information is not enough. We need to understand the motivations, beliefs, and barriers our patients face. That is why it is so important to rely on behavior change theories such as the health belief model and the theory of planned behavior. These models help us design education that resonates and sticks with patients. These models ask, what do patients believe about their health? Why do they perceive different things as risks? Why do they think that they can actually do something? In dermatology, this is meant for me explaining why sunscreen matters even on cloudy days, or helping patients overcome embarrassment about chronic skin conditions. It also means reinforcing the small wins, such as getting someone to finally commit to a consistent skincare routine. Behaviorally informed education leads to more sustainable, long-term changes. And that is what we ultimately want. Not just compliance, but full transformation. Health education must reflect the cultural values, beliefs, and language of the communities we serve. If education isn't culturally competent, it won't be effective, even if the science is sound. In dermatology, I've worked with patients from a variety of backgrounds, some of which believe dark skin doesn't burn, or who use home remedies that conflict with clinical advice. Rather than dismissing these beliefs, I've learned to listen first and teach second. I also try to adapt my language, simplify medical terms, and always check for understanding. A good example is using the teach back method, or asking the patient to repeat the instructions in their own words. It's a simple but powerful way to confirm learning without making a patient feel uncomfortable. The CDC emphasizes that culturally relevant education helps reduce disparities and build trust. When we honor patients' identities and traditions, we strengthen the relationship, and with that, the likelihood of health behavior change. Collaboration in healthcare is critical, especially when it comes to health education. We often think of education as a job for the provider, but really it is a full team effort. From the front desk staff who explain paperwork, to the nurses who reinforce instructions, to the specialists who provide treatment, everyone plays a role in shaping how well a patient understands their care. In my clinic, We've seen that when the entire team communicates clearly and consistently, patients are more likely to follow through with treatment and preventative care. In the clinic I work, there is coordinated messaging between doctors, PAs, nurses, and MAs, all of which strengthens patient trust. As a future PA, I plan to work closely with interdisciplinary teams, not just to ensure that patients receive accurate and consistent information, but to model collaboration and professionalism. The World Health Organization supports this approach, highlighting that interprofessional teamwork leads to safer, higher quality outcomes. And beyond just working with clinical staff, I hope to engage with community health workers, public health educators, and even schools, anywhere where health education can have an impact. My personal experiences within the healthcare field have shaped my beliefs just as much as my academic training. Working in dermatology has opened my eyes to patient knowledge gaps and the opportunity to improve education and, in turn, health outcomes. People often turn to TikTok, Instagram, YouTube, or even friends for advice, and that can lead to harmful misinformation. And this is why I believe so strongly in compassionate, credible education. My graduate coursework has taught me how to assess needs, set learning objectives, and evaluate outcomes. In addition, both my undergraduate and graduate degrees in health education have had a profound impact on how I approach patient care. My undergraduate program introduced me to the social determinants of health, health disparities, and foundational behavior change theory, all of which shaped the way I see my future role as a PA. My graduate program has taken that step further, helping me develop practical skills in health communication, program planning, and evaluation. These degrees haven't just taught me about health. They have taught me how to teach others about it effectively. Volunteering and shadowing have also showed me that education is not just about the teaching facts. It is about connecting, listening, and building trust. As a future physician assistant, I will prioritize prevention, communication, and empowerment in every patient encounter. I plan to use motivational interviewing and theory-informed tools to support patients through their health journeys. I also want to play an active role in developing educational resources, including handouts, videos, support groups, or even health-related apps, especially for the underserved and those dealing with chronic diseases. Long term, I can see myself working in community-based settings or public clinics where I can address both individual and population-level health concerns. I would also love to mentor future health professionals and help build a culture where health education is embedded into every aspect of healthcare. In short, I want to be a provider who treats illnesses but also helps prevent it through education. Health education is a daily responsibility and a long-term commitment. My work will continue to emphasize behavior change theory because we can't simply provide information, we must also help patients feel confident and motivated to apply that knowledge in meaningful ways, cultural relevance because education must be tailored to meet people where they are and resonate with their lived experiences, beliefs, and values, and collaboration because the best patient outcomes happen when healthcare providers work together to deliver clear, consistent, and supportive messaging. In addition to these pillars, I value continuous learning. As the field of healthcare evolves, so should the way that we educate patients. I'm committed to staying current with the best practices and emerging research to provide education that is both evidence-based and effective. As a PA, I will serve as a provider, educator, and advocate. I would like to end today with a quote that captured the heart of my philosophy. An ounce of prevention is worth a pound of cure, from Benjamin Franklin. This quote reminds me why health education matters so much. When we empower people with the right information early on, whether it's about skin cancer prevention, chronic disease management, or healthy daily habits, we can reduce overall suffering, lower healthcare costs, and ultimately save lives. It is important to be the kind of provider that focuses on patient-centered prevention rather than just treatment. Whether I'm educating someone on sunscreen use or helping them to understand a diagnosis, I believe that these small moments of education have the power to create longer change. Thank you so much for taking the time to listen to my presentation. I appreciate the opportunity to share my philosophy.